some time. We actually have some time to have some discussion. Usually we present and then are kicked out of a Zoom room. And so we really do encourage you to use the chat. We're open to lots of questions or reflections, dialogue, but we really do want everyone to be grappling with what we want to talk to you all about today. And so the title is Making the Case for Upending the Child Welfare System. And this comes in large part out of a lot of work that Alan and I have done separately and together within child welfare to address racial disproportionality and disparities. So Alan, if you'll go to the first slide. So this is what we want to talk to you all about today. I'll begin and then we'll kick it over to Alan. So I actually should tell you a little bit about myself first, and then Alan will tell you a little bit more about him. But I've been at the Center for the Study of Social Policy for about 17 years, but before I came to the center, I was a practicing attorney out in San Francisco Bay Area, representing kids in foster care, juvenile justice, special education, probate, legal guardianships. I've never had a client over the age of 18. And I love direct service work. And I always say to folks that we work with at the Center for the Study of Social Policy that please go to direct service before you come and enter the field of policy. And please go back in and do some direct service work as well. But while at the Center for the Study of Social Policy, I have primarily, my focus has been on reform efforts within the child welfare system to tackle racial disproportionality and disparities. I have specifically focused on the experiences of Black children and youth, and then to a large extent, more recently, Latinx children and youth, and then looking also at the experiences of LGBTQ youth and primarily LGBTQ youth of color, and how they're, what they need, what the system is set up to deliver, and how there's still this disconnect where children and youth families are not getting what they need out of this child welfare system, despite our best efforts at reform. So that's just a little bit about me. I should also say I'm a social work dropout. I was going to get a dual degree in law and social work, so I love social workers, but I was just, it was not for me. But anyways, so this is what we're going to do today. We're going to talk about, or we're going to review what we know about racial disproportionality and disparities in the child welfare system, and it's largely looking at it nationally, recognizing that there are local variations. We're going to review the evidence of harm that results to children and families who experience child welfare interventions, and the disproportionate harm that results to Black and Native children and families. And then we're going to talk about the UpEND movement, this movement that the Center for the Study of Social Policy and the University of Houston Graduate College of Social Work have launched together as a response to what we've been seeing and where we have not been able to go as a field. But we will have a discussion sort of throughout. And as Alice said, we'll break at certain points to make sure that we can engage in dialogue with you all. So with that, I'm going to hand it over to Alan, who's going to talk to you through some of this, the data, and then I'll come back to me later.
Great, thanks, Kristen. So to get us started, I'll tell you a little bit about myself as well. So as Alice introduced me, I'm Dean of the Graduate College of Social Work at the University of Houston. But prior to entering academia, I worked for many years in the child welfare system in the Dallas-Fort Worth area of Texas. It was actually the reason why I got into social work, because I wanted to work for Child Protective Services. So my first job after my undergraduate degree was in Child Protective Services in Tarrant County, Fort Worth, Texas. And I specialized the entire time that I was there in doing investigations of maltreatment, initially with in a sexual abuse unit, so specifically investigating sexual abuse cases, and then later in a unit where I was housed with the police department, where we investigated the more serious issues of abuse and neglect. And then my last year with the system, I supervised a unit of investigators. But my entire practice in child welfare has been on the investigations end. I got my MSW at the University of Texas at Arlington through the 4E program there. So I'm very familiar with the 4E program and grateful for all of you who are working in that system. So let me start with kind of a bit of a framing what we're going to talk about today. To start with, much of the UpEND movement begins with our understanding of racial disproportionality, or the overrepresentation of children of color in the system. And it begins with acknowledgement that racial disproportionality has been observed in the child welfare system for more than 50 years now, but persists as a national problem. Due to a debate that's existed in the field over the last decade or so, many efforts to address disproportionality have really stalled. When I was first involved in efforts to address disproportionality in the late 1990s, early 2000s, there was a lot of energy. There were a lot of resources coming to states to address disproportionality and try to do something about it. But over the last decade or so, many of those efforts have really stalled because of a debate in the system that we'll talk about the causes of disproportionality. And the result has been that many of those efforts have stalled, and what we've known to be a problem in child welfare systems for many years persists as a problem. And this is a problem because disproportionate involvement in the child welfare system causes disproportionate harm. And when we have a system that's unable to address that issue, then the system itself is perpetuating that harm. So we'll talk about that a little bit today. And then our belief is that given the inability of the current system to address this harm, it's time to think of something new. It's time to take a radical new approach that really reimagines how we care for children and families. So just a quick overview of what racial disproportionality is. In general, disproportionality refers to the state of being out of proportion. So when we talk about disproportionality in the child welfare system, what we mean is that the proportion of one group in the child welfare population, which we usually mean children in foster care, is proportionately larger, meaning that they're overrepresented, than the same group in the general population. And we've seen throughout history that disproportionality has most significantly impacted Black children. So as an example of what that is, Black children represent about 23% of children in foster care, although they only represent 14% of children in the general population. Racial disproportionality also exists among Native American and Latinx children, but to a lesser degree and with variations by state. So we'll take a look at what that looks like on the next slide. These are national statistics on disproportionality. You can see here the blue bar at the bottom represents Black children in the population, which again are 14%, but you can see they represent 21% of children who are removed, and then 23% of children in care. And then that number goes down when we look at exits. There's fewer Black children that exit, only 21%. For Latinx and white children, you can see that their numbers start out greater in the general population. So for white children are 50% of children in the general population, but only 44% of children in foster care. Latinx children are 26% of children in the general population, only 21% of children in care. That very small light blue bar at the top represents Native American children. You can see that they represent about 1% of children in the general population, but 2% of children in care. So when we look at these national statistics, we see that Black children and Native American children are overrepresented in child welfare systems. It's important to point out here that Latinx children in particular, when we look at this national number, it looks like there's an underrepresentation, but what we're seeing increase year after year is more overrepresentation of Latinx children at the state level. So right now, 20 states, Latinx children are overrepresented in 20 states. Again, when we look at Black children are overrepresented nationally and in 46 states across the country. But now we're starting to see more and more Latinx children be overrepresented in certain states. And then racial disparities is another term that you hear related to disproportionality, but it's slightly different, but they're related. Racial disproportionality in foster care exists because of disparities that occur along the child welfare service decision-making process that impact both entries into the system and exits from the system. So when we talk about disproportionality, we're comparing Black children to Black children in foster care to Black children in the population. When we look at disparities, we're comparing Black children to white children and differences in these decision-making points that happen. And so what we see is that beginning with the point of initial referral, initial hotline calls, Black children are more likely than white children to be reported for maltreatment, to be confirmed or substantiated maltreatment, to be removed from their homes and placed in foster care. And Black children are also less likely than other children to exit to reunification, and they spend longer time in foster care. So it's these disparities or these differences between Black children and white children in both the entries into the system and the exits from the system that create racial disproportionality, or the overrepresentation of Black children in foster care. So before we move on to why disproportionality and disparities exist, any questions here? Those are just some preliminary numbers. I don't see any in the chat.
So far, nothing in the chat.
Okay, great. I'll move on then. So let's talk about why racial disproportionality and disparities exist. It's important to take a little bit of a historical lens here and look at what our early understandings of disproportionality were. And as I mentioned, disproportionality and disparities have been observed for going on 50 years now. It was first brought to national attention by this seminal book called Children of the Storm, Black Children and American Child Welfare, that first documented the overrepresentation of Black children in the system. And since then, we've understood this overrepresentation through what we know from findings from what's called the National Incidence Studies of Child Abuse and Neglect. National Incidence Studies are kind of a federal effort to try to determine the actual rates of maltreatment among children across the country. And prior to 2010, this National Incidence Study had been conducted 3 times, 1980, 1986, and 1993. Those National Incidence Studies showed consistently over time that there were no significant differences in the rates of maltreatment between Black children and other children of other races. So what that told us then is that we have this really significant overrepresentation of Black children in the system, but we know that there's no differences in actual maltreatment rates. So the conclusion to that is that that must be evidence of racism, racial bias in the system. That changed slightly around 2010, started with a critique of disproportionality, the disproportionality movement in an article called Racial Disproportionality in Child Welfare, False Facts and Dangerous Directions. And the author of that paper really questioned these National Incidence Studies findings and said that actually, disproportionality occurs because Black children are in fact maltreated at higher rates than children of other children, and thus should be placed into foster care at higher rates. And so this article really critiqued those National Incidence Studies findings and really looked at data that showed a strong correlation between poverty and maltreatment, and the fact that Black children and families are more likely to be living in poverty, and as a result, more likely to be at risk of maltreatment. What she said is that focus on the claimed racism of child welfare workers puts attention on a non-problem while ignoring the real problems of the Black community, the societal legacy of racial injustice, and the miserable socioeconomic conditions that characterize too many Black lives. And then she went on to say, if Black children are in fact subject to serious maltreatment by their parents at higher rates than white children, it is in their interest to be removed at higher rates than white children. So that received some pushback initially because we had these findings from the National Incidence Studies, but then shortly thereafter, the findings from the National Incidence Studies, a new version 4, were released in 2010, and found for the first time that rates of maltreatment for Black children actually were significantly higher than those for white or Latinx children. And the authors of the study said that the differences that we were seeing now were the result of, one, just greater precision of their study, but the largest difference was an increased gap in income between Black and white families. What we saw in this study is that children in the lowest socioeconomic status households experienced a rate of maltreatment more than 5 times the rate of other children, and Black children were more than twice as likely as white children to be living in poverty. So there was this connection between poverty that explains some of the overrepresentation. What's at debate now is whether what we see in this observed overrepresentation, whether that results from what some scholars call disproportionate need among Black families associated with poverty, or from racial biases in child welfare systems, which we've thought for many years. The fact of this is that research supports both of these things. As I said, there's a large body of research that shows that poverty is the most significant predictor of maltreatment, and Black children and families are more likely to be living in poverty, really because of hundreds of years of structural and institutional racism in this country. But there's also much evidence that we'll talk about in a second about the presence of racial bias in child welfare systems. The challenge to this has been those who have been proponents of the disproportionate need argument have really pushed back on scholars who have continued to talk about the problem of racial bias in the system and have said that actually, no, there is no problem of racism in the system. Any kind of efforts to address disproportionality through anti-racism training, cultural competence training, those are useless, unnecessary, and we shouldn't be talking about racism because it's a non-problem. As I mentioned, there's not actually evidence shows that it is still a problem. What we know about why racial disproportionality exists is if you look at the body of literature, there's four main reasons. One, what we just talked about, disproportionate need resulting from poverty. Two, racial biases among child welfare staff and mandated reporters, as well as institutional racism that's built into the policies and practices of child welfare systems. Child welfare system factors, things like workload issues, turnover, inexperienced workforce, lack of resources to address the needs of children and families of color. All of those things create or contribute to disproportionality. And then geographic context. Concentrated poverty within communities can contribute to child welfare involvement. The important thing to point out here, if you think of all four of these factors, you can kind of categorize them as things that happen outside of the child welfare system, things within communities, poverty, and then there's things that happen within the child welfare system, which is bias. But each of those factors, both the things that happen outside the system and the things that happen inside the system, it's important to acknowledge that both of those result from a common underlying factor, which is structural and institutional racism. This slide here, this slide could actually be a whole webinar in and of itself, so I'm not going to spend a lot of time on it, but it's important to point out that what we see now in the child welfare system and the racism and racial bias that we see is the legacy of the enslavement and dehumanization of people from Africa who were kidnapped and enslaved going back 400 years now. Forced family separation was used by slave owners as a means of control and dominance over slaves throughout our history. So every action that the child welfare system takes now has to be viewed from this lens of racism and white supremacy. Following slavery, we saw decades of policy development that were designed specifically for the purpose of maintaining power and control of white people and maintaining the oppression of Black people. And we saw that in things like the Black codes, Jim Crow laws, redlining, the way the GI Bill was implemented. All of these things were intentionally created to maintain the oppression of Black Americans following slavery. And the result of that is that we see this income gap. We see differences in poverty rates. We see that Black Americans are more likely to be living in poverty. We see that Black Americans are significantly impacted by health disparities that are a direct result of racism. There's a new and emerging body of literature or research that shows that the daily experience of racism significantly impacts not just the mental health of Black Americans, but the physical health of Black Americans. It's a concept called weathering. This experience of racism daily literally breaks down the body and results in the health disparities that we see. And then, as I mentioned, things like the GI Bill, residential racial segregation, all of those things have contributed to concentrated poverty that is more likely to exist in Black communities. So all of these external factors that contribute to disproportionality are the direct result of this country's historical legacy of racism and white supremacy. But then when we look inside the system, it's important to look at the large body of research that shows that racial bias is still a problem in child welfare systems. Even though we know there's these differences that result from poverty, racial biases in the system exacerbate those differences. And I'll share briefly some work that I was part of in Texas. Texas was under a state mandate to address disproportionality in the late 2000s. And they were mandated to examine what the causes of disproportionality were. So we looked at every child welfare case that came into the system over a period of several years, over 176,000 cases. We looked at two decision-making points. We looked at the substantiation decision, whether abuse was confirmed or not confirmed. And then we looked at the removal decision. was if abuse was confirmed, were services needed in that case? And if services were deemed necessary, was removal necessary? Or could the child stay in the home and receive services in their homes? What was important about this study is that we were able to control for things like family income and caseworkers' assessment of risk, meaning we were able to hold constant or kind of equalize the impacts of poverty and risk, as well as other factors like geographic context, single parent household, to try to see to isolate the effects of the race of the child on the decision that was being made. What we saw is that when controlling for both poverty and risk, Black children were 15% more likely than white children to be involved in a substantiated case. And among just maltreated children, Black children were 20% more likely than white children to be involved in a case that's open for services. And of those cases open for services, Black children were 77% more likely than white children to be removed in lieu of receiving in-home services. And again, we were able to statistically control for things like poverty or equalize things like poverty risk. What this told us that the only factor explaining the decision to remove a child was the race of the child. And we saw that Black children were 77% more likely than white children to be removed, which is evidence of racial bias. What we also saw were really important findings in caseworkers' assessments of risk. At the time, Texas used a risk assessment that was a Likert score based on 7 areas of risk, where families could be assessed on a scale of 1 to 5, 5 being extreme risk, 1 being low risk. So 7 areas, you had a high score of 35, low score of 7. What we saw here in both high income and low income cases, Black families were assessed as having lower risk than white families in cases that were deemed necessary for removal. So Black families were assessed as having lower risk than white families, but as we just saw, Black children were 77% more likely to be removed. What this tells us is that caseworkers have different thresholds for taking action on a case, meaning that when risk exists in a case, that risk has to be much worse for a white family for a caseworker to say that removal is necessary, whereas Black children are removed at much lower levels of risk. So again, evidence of bias in the system. So let me pause there in terms of that's what we understand about disproportionality, to see if there's any questions.
There are a couple of questions. We had a question from Bethany, and it was a few minutes ago. And Bethany's question was, what were the categories or definitions of what constituted maltreatment? Bethany, did you want to add anything to that?
No, I was just curious about like if we were talking about neglect, physical abuse, sexual abuse, because I know sometimes, like, especially when you talk about neglect, that one is really kind of, there can be, I don't know how to say, but there could be a lot of bias and kind of like judgment on what would constitute that. So I'm wondering like if there was any designation between what was constituting, I think the term used was like severe or significant maltreatment. And if that was measured in any way in the numbers that were shown earlier.
Yeah, thanks for asking that question. So it didn't measure severe maltreatment. It measured just maltreatment generally. But there was I think the word I used was significant. There was a significant difference between Black children and white children. The differences were found mostly in physical abuse and neglect cases, where Black children were more likely to be either physically abused or neglected. But Bethany, you bring up a really good point, that the NIST, the National Incident Studies, still rely on human decision-making. They rely on people who are surveyed, who include doctors, other medical professionals, teachers, police officers. The NIST calls them community sentinels, but they're basically the whole kind of scope of what we think of as mandated reporters. Those people are surveyed to determine the prevalence of abuse and neglect. So we're still relying on human decision-making, even in those estimates. And it's absolutely possible that those estimates are biased.
Another clarifying question came from Julie, and it was, Any information on how often the maltreatment stems from parents who are struggling with substance abuse issues?
There is information about the relationship between maltreatment and substance abuse in reports that come out from the federal government every year. The Children's Bureau puts out a report called Child Maltreatment every year, and they do provide statistics about the relationship between substance abuse and maltreatment. I don't know those statistics off of the top of my head, but I can certainly send you a link to where that report can be found. There is data about that.
Thank you. And finally, we had a question from Sam. Which states have less racial disproportionality in their child welfare systems?
Great question. Again, one more thing that I don't know off the top of my head. As I said, there's 46 states out of 50 where Black children are overrepresented. I don't know what those 4 states are where they're underrepresented. But again, I could send you actually there's this really great, if you give me a second, I can give you a link to it. There's a disproportionality dashboard where you could look at the different rates of disproportionality by state. Did that work? Great. So at that site, you could look at different rates of disproportionality by state and see the states with the highest rates of disproportionality, states with the lowest rates of disproportionality. I know that there are some states in the country where the overrepresentation of Black children is more than 3 times their representation in the general population. I know that California is one of those states. I think about 10 states, Black children are more than 10 times as likely, but you'll be able to see in there lots of different ways of looking at disproportionality.
One more question from Jenny. Does removal mean that temporary physical custody was taken? How does placement with family fit into that count or definition?
In these counts, the counts that I'm talking about today, removal means removal of the child from the home and then custody taken of the child by the state, whether that child's placed with a relative or in a foster home. So it doesn't include informal kinship arrangements, like voluntary arrangements. It includes cases where the state takes custody, whether that child's placed in a foster home or with a relative. Okay, so let's move on. This is my last section before we turn it over to Kristen. And this is the really important part of it, though, because it's this issue of harm that's caused by this disproportionate involvement. The thing that I always talk about, that nobody talked about when I was a child welfare worker, and I think it's important for all of you to know about, particularly those of you who are 40 students planning to work in child welfare. There's a whole body of research that shows us how traumatic and harmful removal and family separation is. Starting with the act of family separation, research shows that forcible separation of children from their parents is a source of significant and lifelong trauma. What the research tells us is that parental separation results in things like cognitive delays in children, increased aggression, poor educational outcomes, as well as adverse physical health outcomes, things like hypertension, difficulty sleeping, obesity, diabetes. And this research, or these findings, are consistent not just in child welfare systems, but when children are separated from their parents through parental incarceration, through sudden death or divorce, and most recently, when children are separated from their parents by immigration authorities at the border. Over the last 2 to 3 years, there's been a lot of research that's been done about the impacts of family separation at the border. And we see very consistent findings about the significant harm and trauma that's caused to children when they're removed from their parents. But then it's not just that initial trauma. Following that initial trauma, we know that children who spend time in foster care are significantly more likely than children who don't spend time in foster care to experience a host of adverse outcomes. And I have them all listed here. And what's important about some of these studies is that this is a large body of literature that shows the harmful effects of foster care. But there's been a portion of these studies that have been able to specifically compare children who were removed from their homes to children who experienced similar forms of maltreatment but stayed in their homes. So these wouldn't be the most severe cases. These would be cases that would be classified as more like borderline cases. The author of some of these studies called them on the margin. So where a decision could have potentially gone both ways, removal versus staying in the home. And what we found is that among children who experienced similar forms of maltreatment, children who were removed had 2 to 3 times higher delinquency rates, higher teen birth rates, lower earnings as adults, more likely to have learning disabilities, developmental delays, behavioral problems, substance abuse problems, and significantly more likely to have criminal convictions for violent offenses. So this research shows us that foster care, the intervention of foster care, causes harm to children. It's important to point out here that foster care causes harm to all children. Those risks exist for all children who enter care. But the risk of experiencing those adverse outcomes is exacerbated for children of color due to what we talked about before, the ongoing legacy of racism and inequality in America. Black children in America are already at risk of poor outcomes over the course of their lives, including things like economic hardship, poor health, low educational attainment, criminal legal involvement, emotional distress, suicidal ideation, because of the impacts of racism in this country. When we then add the additional trauma of forced separation and placement in foster care, we're making it all the more likely that those outcomes will be realized. So in this way, the child welfare system itself becomes an agent of oppression for Black children, because it's making it all the more likely that they're going to experience the adverse outcomes that contribute to their oppression in society. So I'll pause here for a moment before we turn it over to Kristen to talk about the UpEND movement.
We don't have any questions in the chat. Does anybody have any questions for Alan before we move on? I think we're ready to move on.
Okay, great. Kristen, over to you.
Great. Alan has laid out a lot of the data that we have been studying, looking at, grappling with, but also we have tried lots of different initiatives, programs, promising practices to really tackle racial disproportionality and disparity. But over the last 15 years, despite really concerted efforts, seeing very minimal progress. Might see a flurry of progress, but then some waning or plateauing, or even then worsening. So we got to this point where we were thinking, are we just sort of in this mill of reform and not getting anywhere? Why do we need to upend the system? And so again, this is what the case is. There we have decades of research that's documented that racial disproportionality not only exists, but it persists. And it's also harmful disproportionately to Black children and families. We have the decades of reform and attempts, and it's not to say we aren't going to continue to work at with the kids that are currently in the system, improving their experiences and minimizing the oppression. But that these decades, we have to acknowledge that these decades of reform haven't resulted in the big changes that we wanted to see, and that Black children are still and families are still experiencing harms. And so where we have moved to is, given the inability of the current system to address this, it's time to consider a new framework that reimagines how we care for children, and that framework is fundamentally anti-racist. So I want to talk a little bit about what we mean by anti-racist. And so these are some of the elements of what we are looking at in terms of an anti-racist framework for this work. But that anti-racism, unlike racial equity, is working within the current system to equalize it, to make it more equitable within the system itself for the kids. We're questioning the system, and does the system even work, or should it still continue to exist? So anti-racism is a better term for this work, we think, than racial equity. Anti-racism is a practice, it's a proactive practice that opposes institutional and systemic policies and practices that produce and maintain racial inequities. And that applying an anti-racist framework requires us to be historical, to go back and look at the history of race and racism within the systems where we're working and in the places that we're working. So in Wisconsin, or even in the different counties in Wisconsin, understanding the racism that has existed, the redlining that has existed, and how that has impacted the communities within which children are coming into care. That's an important and critical analysis and part of an anti-racist framework. But an anti-racist framework, again, begins to acknowledging that racial disproportionality and disparities are maintained through the policies of the system and within which they exist, both nationally and locally. Eliminating racial disproportionality requires that we shift our efforts from trying to reduce disproportionality once it exists, so again, working within the system, to examining and remedying the policies and practices that create it. And in the child welfare system, those are the policies and practices that support involuntary separation. We're questioning fundamentally this concept of separation as the prioritizing intervention, and does that make sense? But also, I should say, an anti-racist framework is ultimately also about power and power shifting and sharing. And right now, the child welfare system holds a disproportionate amount of power as compared to communities. By power, it's not just power, it's also resources. And so what does that mean? And an anti-racist framework questions all that and pushes us to reconsider and think about other options. Next slide, Alan. So again, back to a little bit more about why UpEND. Reforms are no longer sufficient. And we are concerned about this harm, and that the harm stopping this harm so that we're not constantly forcibly and involuntarily separating children and their families, and that's not viewed as the prioritizing intervention. That's the way that we're intervening in the system. It's no longer acceptable that we're going to do everything possible not to separate kids and families. And that's the North Star that we would all be working towards. The harm that results from this in the families that are destroyed as a result will only end, we think, through the abolition of the child welfare system and a fundamentally reimagining of how we support child, family, and community safety and well-being. So we want to talk to you about abolition. And we know that when we talk about abolition, it sounds terrifying. So I'm going to talk about abolition in a moment, but hold on, hang in with us. So what is the UpEND movement? It's an emerging collaborative movement. And by collaborative, it's not just me and Alan. It is not just the Center for the Study of Social Policy and the University of Houston Graduate College of Social Work. It is about, there are many people before us who have been calling for the abolition of social work. Some of those folks are scholars like Dorothy Roberts. Some are attorneys like Richard Wexler or Marty Guggenheim. Some are organizers like Movement for Family Power. But we are also want to lend the power and privilege of our institutions to talking about and calling for abolition in an emerging collaborative way where parents, organizers, and youth are at the forefront of shaping and designing this. But that this movement is about ending the involuntary separation of children from their families and increasing meaningful supports so families, communities can care for their children. We believe by really intensely investing in kids, families, communities, there will no longer be a need for child welfare. So we really are, again, seeking to rethink state-sanctioned separation of children from their families as a response to social problems like food insecurity, poverty, lack of affordable and safe housing, lack of meaningful prevention services. And just a word on that last one, I do a lot of qualitative work. I don't do the big quantitative work that Alan does, but in my qualitative work, we see time and time again, and I'm sure you do too, that families are losing their children because they can't get what they need from communities. They can't get the prevention services they need. They can't get the substance abuse, mental health services that they need, but they also can't get fundamental concrete supports. And when they ask for help, they're not getting the help they actually are asking for. They're getting other forms of help, which is often the removal of their child. But also, once their children are removed, they can't get their kids back because they don't have safe and appropriate housing. They don't have legal employment. But there are these, they don't have things that are required of them that they're being individualized. They're being treated as an individual failure as opposed to a larger societal ill. Next slide, Alan. So here we can talk a little bit about abolition. So I don't know how many folks here are familiar with abolition theory or thinking, abolition theory practice, but abolition is not just about dismantling or ending. Abolition is as much about reimagining and creating as it is about getting rid of or dismantling things. And so by abolition, we mean the elimination of the current child welfare system, which is built on surveillance and separation of families, and this fundamental reimagining and recreating. It is not just no more child welfare, and then we've abandoned the need to care for children. That's not, we get a lot of pushback around that, and people thinking, oh, you're just, what is going to happen to these kids? We're worried about these kids. We are too. Alan and I in our practice have experienced or worked with children, families who have experienced extreme abuse, extreme neglect. We are not saying don't help them. We think by abolishing the child welfare system and heavily investing and reimagining this care, you're increasing safety, permanency, and well-being. Because we've been working with the current child welfare system for years, and it is not improving those outcomes. So it means building new ways of protecting and supporting families, and also then dismantling. It is a process. It's not going to happen overnight. But this is our call. This is the call to do something different, to do something more, but really to take the time to imagine, to not keep doing the same things and just trying to do it a little bit better or a little bit deeper. But as we are doing these interventions, again, we're not seeing the big changes that we want to see so that kids and families are ultimately safe. Next slide, Alan. So what do we mean by reimagining? And this is, again, why it's a collaborative. It's if we knew the answers, we would go ahead and tell everybody the answers. But this is a reimagining of our society. This is a reimagining among people, social workers, attorneys, judges, community folks, advocates, but also the parents and youth themselves about what do we need and how can we get it and what would look different. But we do have some ideas. And so reimagining we see as a co-creation process. So we aren't going to come and say, here are the 15,000 things that we think need to happen, or even the 5 things, but we do have ideas. But we want to co-create, again, with community organizers, parents, and advocates. And what would reimagining ultimately look like? We think it's families having concrete supports. We think it's things like a child allowance, universal basic income, healthcare for all. Some of the basic concrete needs are being met by families, safe and healthy housing. But it's also things like residents and communities intervening when needed. So in some of my qualitative work, we're hearing time and time again, mandated reporters are reporting, and they are social workers, and they are reporting because they are concerned, but they are not intervening to support. They're reporting because they think child welfare should come in and do an intervention, but they themselves are not doing the community-based interventions that they could be doing. We also think, though, it's community members who have experienced recovery, for example, providing support to those who need it, that there's a sufficient community array of supports and interventions that exist, and there's a community system of care that can minimize and address harm. Those are just some of the ideas that we have. We've written about this also in the journal Public Child Welfare that talks about it a little bit more extensively. But we want to just sort of let folks know there are ideas out there. We're not the only ones with these ideas out there, but we also want to look to parents and youth themselves for some of these ideas. And so I think we just want to end here with this quote from Ruth Wilson Gilmore, who actually, who's a great abolitionist thinker, who talks about abolition as about presence, not about absence. And it's a way of seeing. Abolition makes you ask when you look, what are you seeing and what would you rather see? Abolition work ultimately is not about what can we do, but what should we do? So we're going to pause here. We're going to end here actually, and take your questions, engage in thoughts and ideas. Oh, and I should say here, if you want to engage with us over, we have a website, upendmovement.org, but we also are engaging on Twitter. So if you're somebody who likes to use Twitter and exchange ideas, we're all for it. So come follow us and engage with us on Twitter at UpEnd Movement.
So we have a couple of things in the chat, and other people may want to jump in as well. And if you wanted to ask a question, you could unmute your video and ask. But a couple of things in the chat. Bethany just pointed out when you were talking about Wisconsin specifically about the use of past tense versus, she said, that still exist not had or did, not past tense in Wisconsin at all with redlining, racism, or disparities.
Oh, interesting.
So that was an astute observation. And then Sam asks, are there any smaller scale examples of this reimagining of the child welfare system, and what were some results?
So there's experimentation happening, and it's happening in lots of different forms, but there are some folks, I don't know if folks are familiar with Rewiring out of the Tennyson Center in Colorado, but they have some, they have foundation money where they are working in, I can't remember how many communities, but different counties, and giving them unrestricted dollars to organize community to keep families together. And how would you use this money? And this money then is also not tied to eligibility. So when you think about these policies and practices that really restrain us and restrain our creative way of helping families, oftentimes it's eligibility for Medicaid or eligibility to get mental health services or child care, all kinds of things. So they're giving unrestricted dollars and seeing what are communities doing and redesigning to keep families together. So they're just in the beginning of this. But one of my favorite examples is they thought that they would be paying for programs or paying for more like therapy. What they're paying for, communities are organizing around are concrete supports, which we're not that surprised about, but also informal supports. So one of the things they have there is something called a granny brigade, which is sort of like an informal home visiting program, but it's elderly. I don't think they're all women, but elderly women who are offering grandma advice to new families and checking in on them, bringing them soup, visiting with them, talking to them about how do you wrap your baby, or what happens when your baby isn't feeling well, but just an extra presence there who's there but isn't under the threat of I'm going to report you. And so they're experimenting in that way, and they're one of our partners. We've reached out to them. They were at a symposium we held out not that long ago to also talk about some of their thinking with that as well.
And I'd add, since y'all are students and you're in Madison, Dr. Christy Slack is kind of the expert in showing how just a moderate amount of financial assistance significantly impacts contact with child welfare systems and rates of maltreatment. So those are examples that really show what a difference financial assistance could make. I remember just a couple of weeks ago, we had an event with Derica Purnell, who is a police abolitionist, but also has lived experience in the foster care system. And she talked about her experience in foster care, that her family was reported because she kept coming to school with baggy clothes that didn't fit. She may have not been able to, may have been a little dirty on a particular day. Someone called Child Protective Services on her. Her family was investigated. She was removed from her mother. And she remembers going to a foster home and hearing the caseworker talk to the foster parent, and the foster parent was complaining about an overdue payment. And she remembers thinking, it didn't register at the time, but years later, she remembered thinking the idea that a stranger was getting paid money for taking care of me when all that my family needed was money. That's a lot about what this abolition work is about. It's about redirecting resources rather than paying strangers to take care of somebody's child, particularly when we know that most cases of removal are the result of neglect, to just giving parents what they need to be healthy, to eat, to have housing. That can significantly lessen the need for foster care.
Thank you. We have a number of questions and comments now. A comment from Jade: it seems like, especially in light of the pandemic's effect on our system and how it's slowing the reports that we depend on in order to intervene, we need to imagine more universal support for families rather than support we cannot target as accurately. Thank you for these thoughts on abolition. There are several questions about for people working, or I'll just read. For those of us currently working in the existing system, what concrete steps can we take? And another similar question: do you have advice for direct practice workers who want to work toward abolition but are bound by state statute and legislation?
I would say, as someone who was a child welfare worker, I think back on my time in the child welfare system often. Like I said, I did investigations of maltreatment for 5 years. I removed many children during that time. When I think back about it now, I know that many of those children didn't need to be removed. It wasn't severe maltreatment. I was very young, very inexperienced, very untrained. And nobody in the agency ever talked about how harmful foster care itself is. There was just this culture of removal, that was the default strategy. We've done research since then that talks about how caseworkers just look at removal as the safe decision because they don't want to make a decision to let a child stay in the home where there's some risk because of the small chance that something might happen. I would say for existing workers, for providers, really understand and think about how harmful and traumatic foster care is. Think about how much parents love their children and how much children love their parents and the trauma that results when you separate them. When I did remove children from their parents, never once did any one of those children say to me, "Thank you so much for removing me from my horrible abusive parents." And when I would go visit them afterwards, all they wanted to know is when they would go home. So just recognizing how strong those bonds are and how seriously traumatic separation and placement in foster care is. And push back when someone else, a supervisor, someone says, "I think we need to remove." Look for family strengths, look for alternatives, look for neighbors, friends that might be able to take a child for a few days if a family is in crisis. There are very few, or it's a very small percentage of cases that are these really severe cases of maltreatment that need an urgent removal. So really just think twice about using that intervention and try and put other things in place.
And I would just add two things. One is in the qualitative work we do, we see families as having to be almost hyper accountable to case plans, to all these sort of, to the court. There's this hyper accountability on families, but there isn't hyper accountability to families. And so if there is a delay in getting family to services, there's no repercussion for that. There's no bad thing that happens if there's a wait list, if these services actually don't really match what a family needs. And so how can you work to build stronger systems of accountability to the families themselves as opposed to all the accountability on the family themselves for sometimes really impossible things? We also do a lot of mapping when we do qualitative work and find like how long it takes for a family to drive or get to different services on public transportation. And is that really a reasonable ask? What's the accountability there to really saying you've created something that's really workable? One of my favorite quotes from a family recently was said to a worker, "Just pick a case plan, any case plan. You guys have so many case plans. I can't sit through another team decision-making meeting where you come up with another case plan for me." So something's not working there. Families aren't getting what they need. And so really thinking about this accountability piece is key. The other thing I would push you to think about, we don't have all the answers and we're very transparent about that, but we want to work with you to get the answers. And so we would encourage you to form groups with like-minded folks who are really trying to challenge the system and challenge the way we do business. Think together, support each other. What are the ways that you can experiment? What should you be learning about that you haven't had a chance to learn about? There's a lot of really good reading and thinking and webinars right now on abolition theory and thinking. We'd encourage you to just deepen your knowledge base on that as well.
Lots of commentary in the chat. I'll copy the chat and send it to you about what you brought up about this idea of what we pay foster parents versus how universal basic income is viewed and some of the inequities there. We have more questions. I want to make sure that I get to them here. Okay, a question. Do you feel that the new FFPSA is a small step towards abolition of the child welfare system as we know it, or do you feel it is more of a Band-Aid solution?
I saw you go on mute, Alan. So, okay, well, I think the jury is kind of out on that, but if you look on its face, it is Family First is kind of a remarkable reform. So sort of some of the positive, right, is it's working to reduce congregate care, which we are wholeheartedly behind and support. And also shifting dollars out of child welfare deep end into, I wouldn't, it's not 100% prevention, right, but it's intervention to keep families together. So that's right. However, where we have grave concern is over the surveillance with Family First and how that might be used. So a lot of this is going to come down to implementation and how it looks and works. So in order, a family has to be eligible. So somebody is deeming somebody eligible to get the services, and the services are right around parenting, mental health, substance abuse. So it's again, eligibility restriction and this level of surveillance, some sort of case plan that has to be worked. And there's a coercive nature that could happen with Family First, which is again, what we're trying to break out of. What we've also seen through a lot of our qualitative work is that families are being penalized for failing family preservation or differential response kinds of services. So if a family already had some sort of supports and it didn't work, and they had another child abuse referral called in, there people are saying, oh, an effort was made and now we're going to remove it. So it's sort of weaponized against the family. We have a lot of concerns about Family First. There's a lot of promise and a lot of unknowns.
Thank you. I want to make sure I hit everyone's questions. Some of these are similar, so there might be a little bit of overlap, but are you working with or supporting child welfare agencies now to address these issues within the system?
So we do work with, so at the Center for the Study of Social Policy, I'll start there and then Alan can talk about the work at Houston. We do a lot of work in child welfare systems. So we ran for a long time something called the Alliance for Racial Equity in Child Welfare. We worked with a number of jurisdictions dedicated to trying to tackle racial disproportionality disparities. That kind of broke up a while ago, but we continue to do work where we're federal court monitors, really pushing systems to shrink and invest in community. We do a lot of technical assistance work, whether it's on equity issues, on LGBTQ issues, on working with youth. And our approach is anti-racist, and our approach is, again, trying to get the system to shrink.
And in Texas, my school is involved in a number of projects with the child welfare system, like Madison is. We're not in direct conversations about any kind of collaborative projects related to the UpEND work, but I'm hoping we'll eventually get there.
I believe that I have hit everybody's questions. Do folks have more questions or comments? You would be welcome to turn on your video and ask a question, or turn on your video and make a comment if you wanted to one of our speakers.
I have to say, I'm so impressed reading the comments that people get this idea of paying parents what they need to be successful. I mean, like, people are saying it's backwards, but there's this societal block somewhere that we think giving money directly to families is a handout, or they're not worthy of that or something. But we're okay using our tax dollars, giving money to strangers to take care of other people's children. It makes no sense. And I'm glad that people are talking about that.
Well, I think that it actually comes down to giving money to like Black and Native families. And so that's where we see that bias again. Like if we were talking about, you know, white families, I think we would be having a different conversation. We wouldn't have this conversation. But when people know and understand the disparities that exist. So because what we're talking about is Black families and Native families and Latinx families primarily, I think that that's where the disconnect often happens, because I don't think that for most people, the idea that yes, if people are poor, if you give them money, they will, you know, do better. That's not revolutionary, but it's who you're talking about giving money to and how much that plays a role into it.
Yeah, absolutely.
Ashley, I see that you turned on your video. Were you going to ask something or no? Okay. Any other questions or comments? Oh, okay, here we go. Apologies, I'm just scrolling here. Okay. Thank you. How have you managed and responded to pushback? I was working for a county here in Wisconsin who was teaming with Aaliyah based out of Minneapolis, and we received so much pushback from so many other community partners. Our county board eventually put a stop to this movement. As a worker, we received so much pushback from trying to keep families safe and connected together. So I think the question is about pushback and how are you managing and responding to that?
I think we start with trying to educate people about what this movement is about, because the pushback usually begins with this idea that we want to just end foster care tomorrow and children are going to be unsafe and unprotected in their homes. And that's not what this is about. This is a gradual strategy to gradually reduce the reliance on foster care and start to use the funds that are currently used now to support this huge foster care industrial complex and use those funds to support families and communities. So starting there and then pointing to what we know the research shows about the harm that foster care and family separation causes children. We try to address it there because in the end, most of the people that I've talked to that have pushback, we want the same things. If you think of that quote from Ruth Wilson Gilmore, who says that abolition is a way of seeing, it's a way of looking, what do you see now and what would you rather see? What we see now is a system that disproportionately surveils Black and brown bodies, disproportionately removes Black and brown children, and then subjects them to an intervention that causes harm. What we would rather see is children and families who have what they need to be healthy, children and families who are able to eat, to have housing, who are able to live in safe communities and neighborhoods, and to create ultimately a society where the incidence of maltreatment is incredibly rare, if it exists at all. We want the same things. So when we are able to engage in conversations with people who have pushback and realize that we actually want the same thing, I think we're able to move forward a little bit. Not everybody, but some.
I was going to say, Alan is more optimistic than I am, and I'm usually the optimist on the team. But so a lot of things with this. One is we're questioning, we're making visible, we think, some invisible workings, right? That why is it okay for Black and Native kids to be removed? A lot of people think that they're better off that way. So we're actually are talking to a lot of people who are saying things to us like foster care is okay because these kids actually end up going to college. But when you talk to youth, that's not their measure of well-being. Youth are telling us things like, we don't have connections. Yeah, I went to college, but I don't have, I only have 2 people I can write down for my emergency contact, and they're pretty shaky. So we actually are really trying to think strategically about who are the people that answer some of the pushback, because sometimes we're not the best people to respond to that pushback. Alan and I are people of color. Sometimes it takes a white person to talk to a white person and kind of have it out about where their differences are, because of all that racial anxiety and all the things about, I don't want to be perceived in this way. I need to have somebody safe to talk through this. So we have a lot of people that we're working with and thinking through what is actually ultimately going on with the person who's lobbying this criticism, or the people lobbying, and who's the best messenger for this. And then is this worth expending our energy and effort on it? Because we have all this other work we're trying to get done to really move forward in a different positive direction. However, when you're doing anti-racist work, you're gonna piss people off because we're calling into question our society. And so we're going to go as far as we can, for sure. And that's why this is a movement, because we want as many people as possible engaging in their internal work as well as this external work of the collaborative to push forward and ask and demand something different and design something different.
I'll add my more pessimistic response here in the sense that Where when we get pushback, where we're not able to have a lot of success, is that there are people in the field that just absolutely disagree that racism is a problem in the system, and will say to you, racism is not a problem in the child welfare system. It's not a thing. Racial disproportionality is all because of poverty. That is very hard and frustrating to counter. One, because you don't have to prove that racism exists to know it exists. We live in a country founded on racism and white supremacy. It's assumed that racism exists in our systems. We have evidence that it does exist in the systems, but this continual pushback that racism isn't a problem in the system, that this idea that somehow the child welfare system could be immune to the racism that plagues every other system that we work in, that's the pushback that's frustrating.
There are more comments in the chat, which you could probably leave or read. Let's see here, but looks like we have another question. These are tricky. Let's see. Okay. Is this also about dissolving the whole structure of reunification TPR adoption? I recall this dialogue a couple years ago presented data that reunification is also not producing positive outcomes, re child well-being.
I'm not sure about that data. You know, what I'd go back to what Kristen said earlier, kind of referenced that the purpose of the child welfare system is not to improve children's well-being in the things that are measured now, like educational outcomes, things like that. We shouldn't be removing children and then saying that they're doing better in school as evidence that the foster care system is working. That's not what the foster care system is designed to do. There are many cases where children will be reunified with their families, and they may not have access to the opportunities that they would have in a foster home, or if they're adopted by another family who has much more means than them. That doesn't mean that we shouldn't reunify. That's not what this system is for. If there are no immediate and urgent safety concerns in homes, then children need to be reunified. So in that way, I mean, we do disagree with the whole notion of termination of parental rights, particularly arbitrary timelines to terminate parental rights like we see in the Adoption and Safe Families Act. Children that are removed right now, the state should be doing everything possible to remove those children. And it's going back to what Kristen said earlier also about the accountability and also what workers can do. Right now, we see that once children come into foster care, it's incredibly hard for them to be reunified. And we often prevent children from being reunified for things that we couldn't remove them for in the first place. If children are on the path to reunification and the immediate safety issues are addressed, you don't have to show that parents have a job. If a parent has a positive tox for marijuana, that's fine. They should still be reunified if there's no immediate safety concerns. But those are the kind of things that prevent children from being reunified all the time. I've been involved in cases where children were refused to be reunified because parents couldn't show a pay stub from a job. They were cutting hair in their home as a source of income, but the caseworker wouldn't reunify them because of that. It's those kind of things. That's the accountability thing. If the immediate safety concerns are addressed, then children need to be reunified.
And I will just say also, we are fundamentally questioning concepts that we've been living with for a long time. So why is termination of parental rights an okay concept for us? Why is that okay? Why is aging out of care an okay concept? Why is that a thing? So we're fundamentally questioning that structure and as a society, is that something we really want and value? No, we really we don't think that's right. We're calling into question, again, what should be versus what's possible, what can we do here? We actually fundamentally want to reimagine something different.
Lots of positive comments in the chat about what you're seeing. There's another question. As child welfare professionals, what economic policies can we advocate or vote for that support the reimagined world that you've invited us to think about?
So many. So I don't know. So there are, think about sort of upstream kind of things that are happening that you think would be everything from that are about quality childcare in communities so that people can work, a living wage, experimentations or full-on universal basic income. We know there are communities across the country right now that are starting to experiment because of COVID with the universal basic income. Follow that, watch that, see what happens, organize around that. One of the things we're pushing for is a universal child allowance or youth allowance for families. Think about also extended leave and paying to take care of your kid while you're on maternity, paternity, parental leave. Those are some of the economic core pieces, but also, and I know it sounds huge, but really we're thinking about communities where kids are being sort of torn out of the child welfare system. And these are communities that have historically been redlined largely, have environmental toxins in them. One of the places we're working in right now, they're still housing with lead abatement issues that haven't been cured. It's all the things. I wish I could just say here's the list, but it is all the things for a healthy communities. And what would you want? And so that's what we would encourage you to back, organize your communities around, and think about it. But also not just economic, but just think about safety stuff, over policing in communities, arbitrary drug laws that increase incarceration. Those are the kinds of things that we really want people to pick apart and question so that things that are ripping families apart, what are the ways that we can keep families intact?
And I just expand on that, you kind of just piggybacking off of that, really thinking through policies. It's not just child welfare that causes harm to children and families, really looking broadly at carceral systems and the harmful impact that they have on families. Everything that we're talking about today in terms of divesting from the child welfare system and reinvesting in families, that's very similar to conversations that we're having about defunding the police. So just recognizing the harm that policing, prisons have on families as well, because all of these systems are related.
One of our audience members is asking, what do you think about family group homes, meaning keeping families together and providing support, counseling, et cetera, to the entire family?
I'm not sure I know everything about that. I would say if those are voluntary arrangements, then I think that could probably may be helpful for some families. I think those kind of services need to be provided, offered to families by agencies, organizations that don't have coercive power.
Alice, can I speak to that? Can you hear me?
Yes, sorry, go ahead.
Okay. That's okay. So I'm in a class currently right now with Jeannie Ferguson, and we just had a discussion about how 40 years ago, she's been doing this career for quite a while. And she said that they addressed this in her agency in New York about how instead of doing group homes for kids, removing them, and I know that it is, of course, a huge bout to do this. I mean, financially and that, but if 40 years ago they were thinking about this, or 20 years ago, I guess I just don't understand why that hasn't been something that's been more in the forefront. So we just want to remove these children, get them to another family, and then not address really what's going on inside of a home. So say that you have, 7 kids that have to be removed. So now you got to find 7 foster homes or whatever. But say that you have a 5 family member family, and they just need to be kept together to keep them the unit together and addressing those parenting skills, the safety of the child. I guess I just wonder how we would go about that policy adoption, or where would we even start? Because it's something that to me interests me tremendously, but I think people are like, it's so overwhelming to even think about. So let's just put that to the side and remove the kids from the parents. That's easier. So that's where that's coming from.
It's, if we think of like steps towards addressing what we're trying to address, that's better than the current model. But I still think we need to get away from like this coercive power of forcing families to do that, because that still causes trauma to families. State intervention, surveillance is harmful to families, and we ultimately want to get away from that.
So what about just then home visiting? Is that just the solution? Like, you know, coming in to solve the issues that they're having, you know, I like, so I just watched the Logan Marr episode thing where the little girl was murdered when she was put into her social worker's home. It's a long story, but anyway, I'm sorry. And there has to be some intervention. There has to be something, but there was no reason that little girl was removed from her home. She was removed because her mother was young and people thought she wasn't, you know, didn't have a pay stub, the things you mentioned. So if we don't want intervention, I mean, if we want the least amount of surveillance and all that, I guess I feel like the home visiting, because I've been working with home visiting programs also, and coming into a home that's very, you know, invasive in one way, you know, surveillance wise, but all the solutions we've been talking about, we're thinking a lot about I'm not wording this well. I'm very, very sick. I'm apologizing. I have tons of drugs in my system right now, but I guess I came in on the back end of this. And so I guess my big thing is give me a practical outlook on if we don't want to be too invasive in these families' lives, and we don't want to have all this control. How do we then make sure we ensure that these children, when I go in and see a situation, and my first initial thought is I don't want to pull them out, what are my options? And I know that's a very big question.
Yeah.
So
Jackie, I think also, so UpEND is calling the question to do something different and something new. So you're taking us into like a specific situation, which I appreciate, but that's
no, I understand.
Yeah, no, I'm just saying the UpEND movement is sort of saying, one, how do we prevent the harm from happening to begin with? But also we're seeing like the harm, meaning a harm that might happen in a family. How do we prevent that to begin? What do we need in our support systems and our networks to do that? But we also recognize sometimes there isn't, the harm is this neglect or poverty that isn't a reason to remove. And so we're dealing with that as well. So, but the other thing, and sort of as you were talking, what you're talking about is what can we do to help? But you're not asking the family, what do they need? And so I'll just, again, I was just doing some qualitative work in a jurisdiction where there was a mother who had 5 kids, was living in a motel, and what she needed was housing, help with transportation, help with getting her kids enrolled in school because they didn't have the IDs she needed to do that. There's a lot of different things that she needed. She got none of that. What she got was a case plan, parenting class, required to do the things like get your kids enrolled, but no help. So that's wrong. That's fundamentally wrong. And she also got in-home visiting, right? So she was able
listen. We need to listen.
She didn't get what she needed. And so that's what we're trying to do, is really rethink how do you get what families can talk about what they need, get what they need, and not get surveillance, not get this sort of coming in a coercive way. So I tell this story all the time about when I was, she's now 12, but when my daughter was an infant, I was like cleaning something and she was crawling around the house while he was cleaning and she licked the pine sol thing. And I was like freaked out as a new mom. I called poison control, which is, on the back of everything. It was the best experience of my life. You got through to the hotline immediately. They were like totally calming me down, asking me what I need, led me through all the protocol around like making sure it was safe. And it was all fine. And they reassured me. Then they asked me for my demographic information, sent me and like subscribed me up to a newsletter, called me back the next day to see how I was doing. Did I need any support or help? That's not how child welfare is. I would call poison control again for help if I needed it, but I wouldn't call child welfare for that. So that's what we're sort of thinking about here.
Any other questions that folks want to ask before we end?
Can I just ask one more thing? And I don't want to like take up the whole thing because I have a lot of thoughts around everything that's been said, but I'm thinking about like the pilot program in San Francisco, where pregnant women, pregnant Black and Pacific Islander women were given $1,000 stipend to help them as a way of like, and I think that the purpose of that was like regarding like infant mortality rates, but also like if we're talking about reimagining child welfare, like isn't that a place to kind of start this? And I'm just curious if you guys are involved in that or know more about like what that looks like in any other places, or if that's even been thought of as like being incorporated into UpEND and kind of this abolitionist work.
I'm not familiar with that program, Kristen, are you?
I'm not, but thanks for letting us know about it. So we could
It's
check
out
them
of
out.
San Francisco. It's a pilot program. I don't know all the ins and out of it, but it is specifically for Black and Pacific Islander women, Pacific Islander women. And they get like $1,000 stipend. I forget how long it is, but I'm really curious about like that and what it looks like. And like if that would be a start, because I think every time I'm in conversations with like various, groups, we talk about like how important that birth to 3 area is when we talk about all these other systems. And so I'm just thinking about how do we really, if we really talk about like reimagining things, is that where we start is like, in pregnancy, especially with our rates of like, all the health issues that Black women and, other women of color face when we're talking about like mortality rates for babies and for women. If that's the place where we start when we talk about reimagining what child welfare is, because that's really, in my head, that's really where it is, as opposed to like just starting at this point where we're talking about, families becoming involved in our systems, but even before that, at the start. I don't want to say at conception, but definitely, before, pre-birth, like how do we build into the reimagining that of making sure that, women and babies have outcomes, birth on.
Yeah.
Yeah, that makes a lot of sense and very much in line with the kind of support that we're talking about. So yeah, I'd love to look into that.
My colleague Cindy just put a link in the chat. Is it the Expecting Justice Abundant Birth Project? Does that sound right, Bethany? Well, anyway, there's a link in the chat. She thinks that that is the right one. And another person is asking, did the UW Institute for Research on Poverty do something similar to that? I don't know the answer to that. Maybe somebody does.
That's Dr. Slack's center though, right? I know they're doing that kind
Yes.
of.
And then I also wondered, since there was a lot of students in here, like, do you guys do work around education and social work education about this idea of abolition? Because I think that like for a lot of social workers, what you learn in school doesn't really give you that the framework to think about that. I mean, you go into child welfare thinking that's what you're going to be doing, but And so is there like any work that you're doing around changing what that looks like as far as like educating social workers and changing, you know, kind of how we see all the systems that we work within?
Yeah, we're definitely in conversations about that, about revisions that we need to make our curriculum, because the real issue is that we can make our curriculum to be as anti-racist as possible and to decolonize social work education, which I think it absolutely needs to be, and we need to all be doing that work. But then what happens is all of our students go to practice through field education in racist organizations, where they can potentially like unlearn all of that. So I think we really have to have a more holistic strategy of making revisions to the curriculum. One, prepare students to go practice in racist institutions, because we know that's where they're mostly going to be practicing, but then try to work from within to dismantle the racism that exists with those agencies. That's the direction I'd like to see social work education go, that it's not more about just going into systems, but it's really about dismantling systems.
And then one more thought, and I'm sorry, this is so fascinating to me, it really is. So I'm sorry to take over. But I just think about
Bethany says you better take up space. Period.
But I just think about like when people talk about like the fragility of whiteness, and I don't even like to use that term. I think of it as volatility, because it just the idea that people get to scapegoat and you know use that as like they get away from it. But like also, how do we build into this idea of, when we talk about social work education, exploring that more? Because I think that's where a lot of times schools fall down, is that we talk about it as like them over there. These are the systems you'll work in, and not enough exploration of like, you play into this, like this is your life. Like we don't do that as much. We talk a lot about the history of social work, but again, with all of our historical lessons, it's like this very broad kind of like, well, this is what happens in the past, but it's not like, no, this is right now, this is the world that you live in. So every day, you know, me as a Black woman, I'm working in these systems with lots of like, you know, young people coming out and not even having an understanding of what that means, what the danger of, I say the danger of whiteness. They don't understand that. They don't have a concept of that. They don't, or they can make the choice to ignore it. And so how, you know, what are the ways that we talk about this and build that into our education, into, you know, especially at the university levels, like what are the ways that we built that into it so that we can have a true conversation about abolition? Because you can't have that conversation about that if you don't have an understanding. And I think that's where again, the disconnect is that we don't have that conversation. And so we can never really have a conversation about abolition, because we're not having a conversation about the true conversations about the danger and the volatility of what whiteness is and how it causes harm to us every single day.
Mm-hmm. Yeah, absolutely. But that's the conversations we need to be having.
Yeah.
You know, my school with a few other schools are hosting a conference that was online yesterday and today, and it will continue next semester. I could send Alice the link to it if you haven't seen it, but it's talking about this. These last 2 days talked about the historical legacy of racism and white supremacy in the profession. But the next session, which is in January, is going to talk more specifically about the problem of racism in social work right now. I think that's the conversations we need to be having. Social workers tend to think that they're free of bias somehow, because we have all of these classes about cultural competence or cultural sensitivity, that kind of thing. And we need to start having much more conversations about the problem of whiteness, how that impacts our jobs, how it impacts our roles as helping professionals, and to really just own that as a profession, our own problems with racism and privilege, and start from day one. At our school, we started providing undoing racism training to all of our students right at the beginning of the curriculum, which I can think kind of starts off on the right foot, but there's just a lot to do in social work education to improve it.
And how often we hide behind social work ethics to say those things. Because I think a lot of social workers fall back to like, well, we have this code of ethics that say we're about social justice and we don't make those judgments, but also like you don't realize that you actually aren't even abiding by those very basic ethical codes. So then how do you even dig deeper to say, well, damn, maybe I am racist. Like, you know what I'm saying? Like people fall back on that of like, I'm a social worker because I agree to abide by these ethical codes. And it's like, that's a fallacy. That's another one of those dangers of whiteness, is that we go by this written code, but we're not honoring what it is. And that code was written under the guise of whiteness, under that idea of whiteness and abiding by these same systems that actually do us harm.
Mm-hmm. And I think there's evidence for that just in what's been happening over the summer. There are groups of students who are calling for NASW to add specific language about anti-racism and white supremacy in the code of ethics. And it's not clear yet that they're going to do that. You know, there's big problems in the profession as it relates to those things.
Okay, I'm done, I promise. This is fascinating. Thank you.
Well, it's wonderful to have an engaged audience, and we had wonderful questions and commentary. Thank you, Bethany, and thank you, everyone, for being engaged with this important topic. I'm glad that we're having this conversation today, and we are just so grateful to Kristen and Alan for spending the afternoon with us. They're both incredibly busy people, and generously gave us this time to start this really important conversation. So thank you both very much. And we all just really appreciate it.
It's our pleasure.
Thank you. Happy to be here.
Thank you. We are going to say goodbye. And as I mentioned at the beginning, our Title IV-E students, if you are a current Title IV-E student, please stay on. And otherwise, to our guests, thank you for coming to our Fall Public Child Welfare Dialogue. We really appreciate it.